Hi, my name is Stephanie Bowerbank, and I'm a student nurse currently attending the University of Michigan. This semester, I had the opportunity to participate in a clinical rotation at a local rehab facility. Today, I'm going to present a patient in which I had the pleasure of interviewing and assessing. The patient I evaluated was a 63-year-old Caucasian male who is single and has never been married. He has a full code in place at the facility and reported that he has had limited work history but was a concession stand worker for a year or so. He also attended some college. Patient stated that due to health complications, he had to stop working and going to school altogether. Patient states that his chief complaint was the weakness and pain he felt from his catheter and bladder. The patient also states that while at home, he had problems getting in and out of bed. Patient denied pain during the interview, and although he did say he experiences angina from time to time. The patient's history seems to be reliable and matched what was reflected in his chart. Patient was admitted in February of this year seeking care for his neurogenic bladder, even though the chart reflects inability to ambulate. His chart also showed that he has taken 13 different medications for multiple diagnoses, including congestive heart failure, atrial fibrillation, type 2 diabetes, morbid obesity, thrombosis, esophageal reflux, bladder dysfunction, cellulitis, glaucoma, left sided blindness, and muscle weakness. Patient also states a self diagnosis of sleep apnea. Patient states that as a child, he had a mild case of cerebral palsy and spent 52 days in an incubator. He also states that he had chickenpox, measles, and mumps as a child. He said his history of chronic illness included congestive heart failure and diabetes. Patient claims he is up to date on all of his immunization. Patient denies any food, seasonal, environmental, or medication allergies. His chart reflected him undergoing a few surgeries, including an appendectomy, tonsillectomy, vasectomy, right or left tenotomy as a child to lengthen his heel, and surgery to remove his left eye due to his glaucoma. Patient denied any history of doing recreational drugs or smoking tobacco. He stated that he was a social alcoholic drinker before he was diagnosed with diabetes, but stopped then after. He stated the same about his caffeine use. He states that his sleep patterns are terrible and that he has many restless nights unless he takes his sleeping pills. He stated that he was diagnosed with sleep apnea 5 years ago, although the chart did not reflect this diagnosis. Patient denies any exercise habits and states that he never really did any exercise before. Patient does not remember the specific time he was last walking without assistance. Patient states that he has experienced some falls at home and in the facility. He explained how he gradually declined to using a walker and is now using a wheelchair when not in bed. Patient states that the facility is trying to set him up with physical therapy and occupational therapy after his insurance and financial situations are sorted out. Patient states that he has been trying to get into his chair at least 3 times a day with the help of staff. When I asked the patient who comes to visit him at the facility, he responded that he has 2 good friends that visit him frequently and who keep in touch on a regular basis. He stated that he does not have a caregiver at the moment, but has in the past and plans on getting one. Patient states that he enjoys going to baseball games with his friends and talking about current events. He also states that he has not been able to get out of the facility lately because he has trouble getting in and out of cars and does not want to be a burden to his friends. He also does not want to ask his friends to deal with his catheter because he needs assistance with it and can't manage it on his own. I asked if he had any stressors in his life right now. He responded saying his life is in shambles. He stated that his biggest concern is losing his housing due to financial issues. He stated that his Medicare benefits cover his stay at the rehab facility, but leave him with minimal amount of money to take care of his other finances. Patient denies having anyone to help support him during this time. He does state that he is able to seek spiritual guidance through his friend whose father is a pastor but is not involved in a church or a spiritual group. Patient has 3 siblings, 1 sister and 2 brothers. His sister lives up north and he talks to her frequently. One of his other brothers also lives upstate, but they are not close and they do not talk. His other brother lives in Arizona and they are close and talk by phone. The patient states he is not comfortable asking them for help with his financial and health concerns. When asked if the patient had any family members who suffer from any chronic illness illnesses. He states that although he never knew his father, his mom and grandmother suffered from heart disease. His mom died of a rare cancer that is unknown to him, and one of his other brothers has type 2 diabetes. His sister uses a CPAP machine at home for unspecified reasons. For a review of systems, I chose to do genital urinary reproductive system due to the client's chief complaint of neurogenic bladder, and cardiovascular system due to his priority diagnosis of congenital heart failure. In general, the patient describes his overall health as poor and says he's not satisfied with it. On a scale of 1 to 10, he rates it at a 4. He stated that his weight and energy level is stable. I asked about any weight changes and over what length of time. The patient responded that 6 months ago he was 353 pounds and that last he was weighed he was 261 pounds. Patient denies fever, chills, and night sweats. Patient confirmed that he has excessive fatigue that interferes with daily activities. Patient denies heat and cold intolerance. Patient states that he experiences chest pain from time to time mid-pericardium. He rates the pain at 5 on a scale of 10. He says that it is an aching type of pain and is relieved by taking Nitrostat. Patient denies any jaw or arm numbness. When asked about his history of heart disease, he stated that he was diagnosed with congestive heart failure over 20 years ago. He says that he has hypertension and also says he was told he had a heart murmur 3 months ago. Patient stated that he is on medication for his congestive heart failure and atrial fibrillation, but is not sure if his murmur is being treated. Patient states that he believes he can go about 20 to 30 feet before feeling shortness of breath. He likes being upright in the bed with at least 2 pillows. He states that he does not like being in a flat position. Patient denies feeling any palpitations and says that he thinks his heart condition is controlled well with medication. I asked the patient if he had any other concerns, and he states that whenever he does experience angina, he gets very uncomfortable and thinks it has to do with his heart, although he said it could be his acid reflux. Patient denies pain when urinated and rates it at a 0 on a scale of 10. Patient states that he has had a catheter since being at the facility and that it was infected a little over a month ago, rating that pain at 10 out of 10. Patient states that he believes the frequency of his urination is normal. He has experienced blood in his urine, but not recently. He also states that sometimes his urine appears dark. Patient denies nocturia. Patient denies pain in genitals, but does admit to being uncomfortable related to his personal hygiene. Patient denies having a discharge and lesions on his genitals. Patient denies being sexually active in the past 6 months and any contraction of STDs. Patient states he is not aware of any prostate problems and says that the history of his family's prostate problems is not known. Patient denies doing self-testicular exams and says that his urologist has checked his prostate in the past but not recently. Upon taking vitals, I received a blood pressure reading of 138/68, which is higher than normal, a irregular pulse rate of 68, and a respiratory rate of 20, which is also within normal limits. Physical assessments were done while the patient was in an upright seated position. The first physical assessment I completed was a cardiovascular exam. Upon inspection, the patient was warm, dry, and intact with obese body habitus and even fat distribution. Upon palpitation, no heaves or thrills were present. Point of maximal impulse was felt at the apical pulse. Upon auscultation, I noted that the patient had a regularly irregular heart rhythm and a rate was at 68 beats per minute. The patient had distant heart sounds, but S1, S2, and an intermittent S3 was heard in the seated upright position. The second physical exam I did was an abdominal exam based on the patient's chief complaint of neurogenic bladder. Upon inspection, I found that the patient has a convex contour with normal color and even hair distribution. No peristaltic waves were noted. Upon auscultation, the patient had active bowel sounds in all 4 quadrants. No bruits were present over the aortic, renal, iliac, and femoral arteries. Upon auscultation, patient reported no pain with light or deep palpation. After completing peritoneal tests, I found that rebound tenderness, cutaneous hypersensitivity, arbitrator, and iliopsoas tests were all negative. Although I did not do any additional assessments on specific systems, it is important that my patient would have also got a full review of his respiratory and peripheral vascular systems. Respiratory system would need to be assessed primarily because the patient's diagnosis of CHF and morbid obesity. According to the American Heart Association, it is increasingly apparent that congestive heart failure affects not only the cardiovascular system, but every organ system involved with oxygen transport, including the respiratory system, skeletal muscles, and the hormonal and neurofeedback control systems for breathing, cardiac output, blood pressure, blood volume, and distribution of blood flow. According to the International Journal of General Medicine, obesity is also strongly linked with respiratory systems and diseases including exertion dyspnea, obstructive sleep apnea syndrome, and obesity hypoventilation syndrome. They also say that the negative physiological effect of obesity on lung function has been demonstrated in numerous studies. My patient's peripheral vascular system should also be checked due to his diagnosis of diabetes and thrombosis. According to the AHA Journal Clinical Cardiology New Frontiers, vascular diseases are the principal causes of death and disability in people with diabetes. They also state that platelet function and plasmin coagulation factors are altered in diabetes, favoring platelet aggregation and propensity for thrombosis. Due to these facts and knowledge of my patient's diagnosis of CHF, morbid obesity, thrombosis, and type 2 diabetes, it would be imperative to assess these additional symptoms. This concludes my presentation. Thank you for listening.